Hi, this video is about Eric Eruption Tai's son's health condition that he mentioned in his latest blog. I'm sure everyone knows him, but if you don't know him yet, Eric Tai is a Tongan-born Filipino actor, model, TV host, comedian, professional sports player, rugby union player. A few weeks ago, Eric was also selected as Magnolia Hotshots' third overall pick. Over the past few weeks, he is even becoming more popular because of the tingting tang dance craze, which he get million views in his short videos. Wow! Congratulations! So, what is the special condition of the son of Eric Tai he mentioned in his latest video? Keep watching to find out. This is Health.Faith.Fullness channel. I'm Dr. Mel and I am a pediatrician. Before I continue, please make sure to subscribe, hit the bell icon for notifications. Let's begin. The special health condition of Eric's son he is mentioning is Asperger Syndrome Disorder or ASD. Please watch till the end as I will describe the different signs and symptoms, the different challenges that people with ASD may encounter, and more importantly to know the treatment so we can help our child to grow and live meaningful lives. Asperger syndrome is a neurodevelopmental disorder that affects the way a person communicates and interacts socially and processes information. It was once considered a separate disorder from autism. It is now classified as a form of Autism Spectrum Disorder. What are the signs and symptoms of children with Asperger's syndrome? 1. They may have difficulty with social cues and nonverbal communications, such as making eye contact or understanding facial expressions. 2. They may have also trouble with social interactions, such as initiating conversations or making friends. 3. They may have intense interest in specific topics or activities. Eric Tai mentioned in his video that his son at 2 years old had already a photographic memory and was able to memorize all the different flags around the world. Wow! However, they struggle with changes to routines or unexpected events. Although these children with Asperger syndrome present with challenges, many of them will have unique strengths and talents, just like Eric's son, who has an exceptional memory skills or a high level of attention to details. While the exact causes of Asperger syndrome are not yet fully understood, it is believed to be a combination of both genetic and environmental factors. This condition is often diagnosed in childhood, but some people may not receive a diagnosis until later in life. Individuals with Asperger syndrome may also struggle with nonverbal communications such as facial expressions, tone of voice, body language, which make it difficult for them to understand social cues and build meaningful relationships. They may also have difficulty with empathy, finding it hard to understand and respond appropriately to the emotions of others. So, when your child is diagnosed to have Asperger syndrome, don't feel sad and discouraged. They have their own strengths and they have the ability to focus intensely on their interest and engage in detailed and focused learning. That's why they can still excel in school. Most of them have a strong sense of justice and may become passionate advocates for the causes that they believe in. If you or someone you know has Asperger syndrome, it is important to seek out resources and support. So, how are they treated? Asperger syndrome can be managed with a variety of therapies and interventions. Social skills training and cognitive behavioral therapy can help individuals with Asperger syndrome to improve their social communication and manage anxiety and stress. Medications may also be prescribed to manage co-occurring conditions such as depression or anxiety among patients with Asperger syndrome, it is important to seek support from professionals and organizations that specialize in working with individuals on the autism spectrum. With the right support and interventions, these patients with Asperger syndrome can lead happy, fulfilling lives and make valuable contributions to the society where they live in. When you notice the different signs and symptoms of Asperger syndrome on your child, it is better to seek consultation with your pediatrician right away. Ideally, your child should be evaluated by a developmental pediatrician. But here in the Philippines, there's not much developmental pediatrician here in the provinces. So, visit your pediatrician. They can easily diagnose your child. Please continue watching until the end and learn about some tips you can do to help your child while waiting to be seen by a developmental pediatrician and an occupational therapist. Now, here are some of the tips that I can share to parents and caregivers on how to improve the communication skills and behavior of your child with Asperger's syndrome. Be patient and understanding. Children with Asperger's syndrome may struggle with communication and social interaction. It is therefore essential to be patient and understanding when communicating with them. They may need more time to process information and will respond appropriately. Use clear and concise language. It is essential to use clear and concise language when communicating with a child with Asperger's syndrome, using metaphors or idioms as they may confuse your child. Give specific instructions. When giving instructions, be specific and break them down into manageable steps. Use visual aids such as pictures or diagrams to help your child understand. Use positive reinforcement. Children with Asperger's syndrome respond well to positive reinforcement. Praise them when they communicate effectively or display a positive behavior. Be consistent. Consistency is a key when communicating with a child with Asperger's syndrome. Stick to a routine and use the same language and communication style every time. Teach social skills. Social skills do not come naturally to children with Asperger's syndrome. Teach them social skills such as how to initiate a conversation, how to take turns, and understand body language. Provide opportunities for social interaction. Children with Asperger's syndrome may struggle with social interaction, so it is very essential for you to provide them with opportunities to interact with others. For smaller kids, let them play with other children. For older children and adults, let them join clubs or groups that interest them. Seek professional help. As I said earlier, it is better to consult your pediatrician as soon as possible. If you are struggling to communicate effectively your child with Asperger's syndrome, your pediatrician can refer you to a developmental pediatrician or an occupational therapist to help you develop communication strategies and provide support. In conclusion, communicating with a child with Asperger's syndrome can be challenging, but with your patience, understanding, and consistency, you will improve your child's communication skills and behavior. Just remember to use clear and concise language, give specific instructions, use positive reinforcement, teach social skills, provide opportunities for social interaction, and seek professional help if necessary. If you liked this video and learned something, please subscribe, like, and share. Thank you for watching. And to the new parents, please watch also one of my old videos, Pediatrician's Top 7 Advice on Newborn Care.